Since 1981, HIV has taken a toll on Americans from nearly every demographic in the U.S., and 40 years later, the virus is still taking a devastating aim at Black and LGBTQ communities. According to the American Foundation for AIDS Research, 1.1 million people are living with HIV, and nearly 39,000 Americans become infected each year. African Americans account for a whopping and disturbing 43% of all new infections, despite representing less than 14% of the U.S. population. So, Phill Wilson, a trustee for the American Foundation for AIDS Research, joins us now from Los Angeles. He's also the founder of the Black AIDS Institute. Thank you so much for joining us this morning, Phill.
My
just
pleasure.
mentioned Black people represent 43% of all new HIV infections. That's a troubling statistic. Why is it important for you? Why was it important for you in 1999 to create the Black AIDS Institute?
The reason why we created the Black AIDS Institute in 1999 is because it was very, very clear to us that Black people were being disproportionately impacted and not enough was being done. Equally clear is that we understood that the only way that we were going to be able to end the AIDS pandemic in Black community is to enhance and create and support Black leadership. Now, no one was going to save us. And as Calvin Rolark from the Black Fund in Washington, D.C. said, no one can save us but us.
In the United States, 67% of all new HIV infections occur in gay men and other men engaging in same-sex relations. But there's still such a stigma with the virus. For example, there are people such as Billy Porter, who just revealed he's been silently living with HIV for over 14 years. Help us understand why this is so stigmatized still today, especially when we consider its impact on communities of color.
Well, HIV and AIDS is the perfect storm for stigma. It's a disease. In the early days, people didn't know how you got it. It was sexually transmitted. The largest percentage of people who were being impacted were marginalized communities. They were Black, they were Latino, they were poor, they were from the LGBTQ communities. They were trans women. They lived in rural communities. So all of the others came into play. The second issue, I think, why the stigma, while it has gotten better, has persisted, is that initially there was not the resources invested in the communities most impacted. And the third reason, I think, is because the work that was being done in Black communities, the acknowledgement that there were Black heroes involved in the fight against HIV and AIDS, there was not enough awareness around that as well.
I think it's been 40 years or so, and Vlad and I will remember the beginning of the AIDS epidemic, and then sort of a movement to people talking openly, the fundraising, the coalescing around the communities that were sort of greatly impacted. And I think now we sort of ease into this other area when it comes to HIV and AIDS. There are really, really good medications out there, so often people can live very long, healthy lives. And I don't know if there's enough healthy fear of the disease, but you would know better than me. But I'm learning now, because this is new to me, that there are people making a choice not to know their status altogether. There's so much information, so many resources out there to help people live a long and healthy life. Can you explain this mentality, why people would avoid getting tested?
Well, I challenge the assumption that people are proactively avoiding knowing their status. I still think that there's a lot of work to do around education and awareness and resources and access. Now that, just like we're discovering with COVID-19, the existence of a vaccine or the existence of a treatment, or as we say, a few pills that work for some of the people some of the time does not a cure make, is not sufficient infrastructure to provide actually access to whatever we're talking about, whether it's treatment, whether it's testing, whether it's vaccines, what have you. What I would say that today, where we need to be concerned is the threat of premature claiming of victories. Now, as you pointed out, HIV and AIDS is still very much with us, but not enough people know about it. There is still a disproportionately low amount of investments in Black and brown and poor communities. We need to actually get to the finish line. The way to do that is to support those institutions and, quite frankly, to acknowledge, the work that's being done. One of the challenges is that, people can feel the dangers of hopelessness. And so we have to acknowledge the successes, and we need to make sure that we are talking about all the people who are impacted with the disease against the balance of the risk.
Let's talk about the mental toll the virus can take on people who test positive for HIV that are open about their status. Help us understand the obstacles they face and what needs to be done to help them.
Well, we're discovering more and more and more that we have to invest a lot more in mental health. Now, the issue around mental health does not get nearly the amount of attention that it deserves. We don't, quite frankly, embrace how important mental health is to physical health, or even why there's a distinction between the two is baffling to me. But certainly, what happens when someone is living with HIV, whether they're living with HIV for basically 40 years like myself, or whether they just found out they're HIV positive yesterday, kind of adjusting your view of the world, your expectations of the world, the uncertainty certainly can undermine your mental health, and finding support and finding resources to address that. That combined with the discrimination that exists because you might be HIV positive, or because you might be Black or brown or poor, or you might be a woman, or you might be a trans person. That again creates that perfect storm that creates and enhances and exacerbates mental health issues.
Really important discussion. Phill Wilson, thank you so much for coming on and talking to us about it. I'm glad we're having this discussion.
Thank you.
CBSN is marking Pride Month with 4 weeks of coverage. Topics include everything from the politics of pride to families, education, and health. You can also get our content on demand on the CBS Village page on cbsnews.com.